Hello, everyone, and welcome to today's webinar, Managing Healthcare Expenses in Retirement. I'm John Williams with Bautis Financial, and a lot to cover today. I'm going to hold the questions till the end, and so if you don't have time to stick around to the end, please feel free to email me with any questions you might have at john, John, at bautisfinancial.com. Or if you want to set up a free consultation, a free call to just discuss your unique situation so we can answer any questions that you have, please feel free to do that at the link below, or you can go to our website at www.bautisfinancial.com and just click on the link, schedule a call. All right, so without further ado, I'm going to shift over here to the presentation. Today, we're going to be covering 3 key points at a high level. The first key point is when you should be applying for Medicare and what would be considered on time. It's really important that you do sign up on time because there is a penalty involved, and many people don't know when they have to sign up. There's going to be different windows, which we'll go into in a little bit. And if you are late and not signing up in that specific window, there's a monthly penalty that you will have to pay for the rest of your life. So it can be quite costly. The second key point is that if you don't get the right private insurance to go with your Medicare, you may pay too much in premiums and out-of-pocket costs. The fact that you even need private insurance to go with your Medicare is a surprise to most people. Some people think Medicare covers everything, but it doesn't. In order to have prescription, in fact, even to have prescription drug coverage, that's going to be a separate policy in most cases. And there's other out-of-pocket expenses related if you don't have the additional coverage with the Medicare, which we'll go into more detail, of course. The third key point is that if you do not plan for these higher healthcare costs in retirement, you could run out of money. And people are usually happy to go on Medicare when they turn 65 because it provides some relief against high healthcare insurance premiums that they may currently have. But you must be prepared for a higher future healthcare costs in your retirement budget. And the best time to do that to consider that is now. You'll see what I mean a little bit later as we get into more of the detail. The presentation today will be divided into 3 parts. In part 1, we'll be talking about Medicare. What is it? Who needs to enroll in Medicare and when? And how do you enroll in Medicare? In part 2, we'll be discussing the private insurance that goes with Medicare. To understand the private-public partnership that is Medicare, we'll be talking about how much Medicare costs, what it covers, more importantly, what it doesn't cover, and how private insurance integrates with Medicare. And in the third part, we'll talk about how to plan for higher healthcare costs in retirement. There are 2 reasons why our healthcare expenses will be higher in the future. One reason is, of course, inflation. The other is increased need for healthcare services as we age. And one expense that needs to be planned for is also long-term care. Some of you may have had experience with a parent or a relative needing some help with daily living activities, such as bathing, dressing, or just keeping up with housework and preparing meals. Many people are surprised to find out that the costs of these services are not covered by Medicare. Okay, so let's start out by talking about the Medicare enrollment. Let's start out by talking a little bit about how Medicare, who is going to qualify for Medicare, who pays for it, and if you're under 65. Your health insurance is usually work-based. If you're still working, you're employed, your employer probably provides health insurance for you. If you're retired, you might have a retiree plan, or maybe you recently left your job and extended your coverage with your employer's plan at your own expense under what's called COBRA. Or maybe you've even purchased your own individual health insurance policy. Maybe you're self-employed. After 65, Medicare generally pays first. That is, our health insurance system is set up so that once a person becomes eligible for Medicare at 65, most private insurance becomes secondary to Medicare. So when you incur a healthcare expense, the bill is submitted first to Medicare, after Medicare pays what it's going to pay, any other insurance you may have, any other insurance plans you may have with your employees will pay the rest. The only exception is employer group plans that cover 20 or more employees. So if you're still working and covered by such a plan where there's 20 or more employees, or if you're covered as a spouse under such a plan, your employer will pay first. So there is that exception. This has implications for enrollment as well, because you're going to, if you are you are under this category of 20 with an employer of 20 participants or more, there's going to be a different enrollment time. What this means is that unless you are covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. First point. What if you don't enroll in Medicare on time? Well, the consequences are pretty costly. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher the penalty will be and will continue for the rest of your life. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill. And finally, your private insurance options may be limited. If you're in poor health or have a pre-existing condition, the private insurers that coordinate with Medicare have to take you as a client if you sign up for Medicare during your enrollment period. But if you don't and you go to apply for private insurance later, you may not be able to get insurance, or you may be charged a higher premium in that case. So let's take a quick step back and just talk a little bit about what Medicare is. Well, it's basically a national health insurance program for people over 65. It was signed into law in 1965 by President Johnson, and it's administered by the Centers for Medicare and Medicaid Services, the government program, and enrollment is handled through the Social Security Administration. So just some key important points there. Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the United States continuously for at least 5 years. Some people under 65 can get Medicare if they receive Social Security disability benefits. Our discussion today will with that said, our discussion today will only pertain to the first group, which is people over 65. Now, Medicare is divided into 4 parts. Part A covers part of the cost of hospitalizations. Part B covers part of the cost of medical services, such as doctor visits, procedures, diagnostic tests. And the bills for Parts A and Part B are paid by Medicare. Part C and Part D are where the private insurance comes into play. Part C is an alternative way to get Medicare. You can sign up for Medicare Advantage. You can sign up for a Medicare Advantage plan offered by a private insurer and get all your services under Parts A and Part B, and usually prescription drug coverage as well through the plan. Instead of Medicare paying for your hospital and doctor bills, it pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan is responsible for managing all of your care and coordinating your care. Now, Part D is a prescription drug coverage. It's offered by private insurers who contract with Medicare. Each prescription drug plan is slightly different, which is why you want to shop carefully for your drug plan. Even if you don't take drugs, any prescription drugs right now, when you first go on to Medicare, or when you first go on to Medicare, you'll want to sign up for Part D drug plan anyway, because if you go without a drug coverage for very long, you'll face a penalty when you finally do enroll. This image shows 2 ways to have Medicare. If you go with the original Medicare, you sign up for Parts A and Part B. Then you decide if you want prescription drug coverage under Part D. This shows drug coverage as optional, but it can be dangerous, as I had mentioned before, for the reasons being costs and penalties, to go without a prescription drug coverage for very long. In step 3, you'll decide if you want supplemental coverage. Again, Medicare shows this as optional, but there are a lot of costs that Medicare won't cover, and it leaves a lot of gaps. The second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. There are many companies in this area, in your area, offering Medicare Advantage plans. So if you go this route, it would be important to shop for plans and find out what meets your needs and what plans meet your needs. And again, drug coverage is shown as optional, but we would recommend that you choose a Medicare Advantage plan that also offers prescription drug coverage. Choosing how you take Medicare is of course a big decision. It needs to be individualized, and we can't. It's because it is individualized, and that's why I mentioned if you want to talk specifically about your situation and talk through some of this, we'd be happy to. Even though there's a lot of detail and there is a lot related to your unique situation and considering the direction you want to go, we'll just talk about some of the pitfalls that you want to be aware of. If you're receiving Social Security when you turn 65, you will automatically be enrolled in Parts A and Part B. If you're working and covered by an employer group plan, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Medicare Parts A and B, and your coverage will start on the first day of the month you turn 65. Part C and Part D are not automatic. If you want a Medicare Advantage plan, you'll have to contact the insurance company offering it and sign up for Part C through them. Or if you want to stay with the original Medicare and have a standalone Part D prescription drug plan, you'll need to decide which insurance company's plan you want to go with, and you'll have to proactively enroll with them as well. You should do this at the time you are enrolled in Parts A and Part B before your 65th birthday. What if you're not receiving Social Security when you turn 65? Well, more and more people are continuing to work, or at least delaying the start of Social Security in order to receive a higher benefit. And in this case, you'll need to proactively enroll in Medicare during a Medicare enrollment period. There are three main Medicare enrollment periods. The initial enrollment period applies if you're not covered by a group plan that covers 20 or more employees when you turn 65, as we mentioned before. If you are covered by an employer group plan because you or your spouse is still working, you have a special enrollment period, which I'll get to in more detail in a second. If you miss either of these enrollment periods, you can sign up for Medicare during what they call a general enrollment period, which again, we'll get to in detail. The initial enrollment period for people who aren't covered by a group plan at 65 starts 3 months before you turn 65 and lasts until 3 months after you turn 65. Although it lasts a total of 7 months, you'll really want to enroll in Medicare during that 3-month period before you turn 65. Then your Medicare coverage will start on the first day of the month you turn 65. And by the way, if your birthday happens to be on the first day of the month, everything is moved up a month. Just pretend your birthday is in the previous month. For example, if your birthday is June 1st, your initial enrollment period would start February 1st. If you signed up for February, if you signed up during February and March or April, your coverage would start May 1st. So we've been talking about signing up for Medicare as a whole, but there are three times when we need to break into different parts. Now, most people will sign up for everything all at once, but there may be times when you'll sign up for some parts and not others. If you're still working when you turn 65, check with your benefits administrator to see if you should sign up for Part A. We mentioned earlier that if you are covered by an employer group plan when you turn 65, and you'll have a special enrollment period that comes later. However, you may want to sign up for Part A when you first become eligible for it at 65. The reason is that it may offer better coverage for hospitalization than your employer group plan. So if you do fall into that category, you want to see if Part A makes sense, even though that you aren't necessarily going to be, even though you do have a plan or part of a plan that has 20 employees or more, it may be worth checking. And Part A is free, so it's worth checking it out. If your employer group plan is a high deductible health plan paired with a health savings account, and you want to keep contributing to the health savings account, you should not sign up for Part A. The reason is once you enroll in Medicare, your HSA contributions must stop. But let's be clear, if you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop the HSA and sign up for Medicare during your initial enrollment period at 65 regardless. If you're not covered by an employer group plan when you turn 65, you'll want to sign up for Part B during your initial enrollment period. preferably that 3-month period before 65, as we mentioned. So if you're not working, if you're self-employed, if you're employed by a company that has fewer than 20 employees, if you're on COBRA, even if you're receiving retiree health benefits, you want to sign up for Parts A and B during the initial enrollment period. If you sign up for Parts A and Part B during your initial enrollment period, and if you think you will ever in your life want prescription drug coverage, you should also at that time enroll in Part D for a prescription plan and shop those companies. If you go more than 63 days without credible prescription drug coverage, you will pay a late enrollment fee penalty when you finally do sign up for Part D. So it's better to just go ahead and get that coverage from the outset, even if you're not currently taking any drugs or prescription drugs. As mentioned before, you have two options. You can enroll in a standalone prescription drug plan if you have original Medicare, or you can get drug coverage through a Medicare Advantage plan. All right, so that takes care of the initial enrollment period. Now we're going to talk about the special enrollment period. This is for those people who are part of a plan with an employer with 20 or plus more employees when they turn 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up for your special enrollment period. The best time to sign up for Medicare for you is going to line up when before your current coverage will end. So obviously when you stop working, or not necessarily just when you stop working, but when your coverage ends, maybe it might continue past. You just want to find out from your administrator what that looks like when you do plan on finally retiring. This way you'll have no gaps in coverage. You want to make sure you line that up. But regardless, you will have a grace period that's several months ahead of when your plan will end. For Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, it's only 63 days. To summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or special enrollment period, but to avoid gaps in coverage, it's more important for you to sign up before the current coverage ends and not waiting until the last minute. Now, what if nobody ever told you about these Medicare enrollment periods and you didn't sign up when you were supposed to? Well, that gets us to the third way of signing up. You can still sign up by, there's what we call it, Medicare's general enrollment period, and that runs from January 1st through March 31st of each year. This is the only time you can sign up for Medicare if you are outside of your initial special enrollment period or initial enrollment period. The coverage starts the month after you enroll, so as you can see, this could leave with some coverage gaps. So you really want to avoid having to sign up during the general enrollment period because there could be large gaps depending on when your birthday is or when your coverage ends with the 20 plus plan. So it's really important to understand the initial nailing down the initial enrollment period or special enrollment period. So you avoid those, especially so you avoid those coverage gaps. All right, so let's do just a quick overview of the enrollment periods. The initial enrollment period is for everyone age 65 who is not covered by an employer plan with 20 plus more employees. Best time to sign up is 3 months before your birthday. Special enrollment period is for everyone that's on one of those plans over 20 plus. And there you're going to want to look at when your coverage ends and sign up a few months before your current plan, your 20 plus employee plan ends, so you can so there's no gaps in coverage. And then of course, if you missed either of those, there's a general enrollment period, which is January 1st through March 31st of each year, where you'll be able to catch up and sign up. But like I said, best to avoid this general enrollment because it most likely will leave some gaps in your coverage. All right, so now let's get us to how do you sign up for Parts A and Part B. It's actually fairly easy. As I mentioned, if you're already receiving Social Security benefits when you turn 65, you'll automatically be enrolled in Medicare. But if you're not, you can go to the website ssa.gov and click on Medicare and click on the big apply for Medicare benefits button. Or you can call by phone, 1-800-772-1213. Part D is not quite as straightforward as Parts A and Part B. We want to shop around, look for the best plans that are available for you, and whether you're going with the original Medicare versus Medicare Advantage, you're going to want to, obviously, like we had mentioned before, shop around and making sure that you have the correct coverage through the Medicare Advantage or a Part D plan with the original Medicare. Now, this brings us to Part 2, which we're going to talk a little bit about private insurance and how it works with Medicare. This pie chart shows the breakdown of spending by the average Medicare beneficiary for premiums and services. As you can see, almost half of the spending, or roughly $2,300, is for insurance premiums, while roughly $3,100 is spent on services, including long-term care. The total out-of-pocket spending by the average Medicare beneficiary is a little under $6,000. These figures are for 2016, which are the latest, is the latest information that we have available. But you're looking at about roughly $6,000 a year if you look at that breakdown. Focusing on the out-of-pocket costs paid by Medicare beneficiaries, they fall into two main categories. One is, of course, premiums, and second is out-of-pocket costs. Monthly premiums are paid by Medicare and to the insurance company. So there's mostly going to be a Medicare premium, and if you have a private insurance company that goes with Medicare, the premium is going to go to that private insurance company for a drug plan or a Medigap or a Medicare Advantage program. Out-of-pocket costs will also include some deductibles that go along with those plans, the portion of your bills that are not paid by Medicare, and the services not paid by Medicare. Now, first, let's look at monthly premiums. Part A is free if you or your spouse has paid into Medicare for over 10 years. This is one reason most people sign up for Part A when they turn 65, even if they're covered by an employer group plan, because it may actually save them some money, and it doesn't cost anything. Part B is different. It costs about $174.70 per month. That's the cost in 2024. It will be adjusted for inflation, so depending on when you're planning on signing up for this plan, it could be slightly higher. And also, higher income beneficiaries will pay more. The Part B premium is paid to Medicare. Part D premiums, like we had mentioned before, are paid to the private insurance company, but there will be higher premiums for those who have higher income in retirement. The table shows the Part B and Part D premiums for the different income levels. If you're single and your income is under $103,000, or if you're married and your income is under $206,000, you'll pay the regular Part B premium of $174.70 per month. There will be no income-related adjustments in this case, but if your income falls into one of these other tiers, you'll pay an income-related adjustment on top of the base premium of $174.70. For example, if you're in the second tier, you'll pay an extra $69.90 for Part B and $12.90 for Part D on top of your regular premiums of $174.70. This will bring your total to per month of $257.50. And keep in mind, this is per person. So if you're a couple, you will, of course, have to double these amounts. Your tax return from 2 years ago is used to determine this income-related adjustment. So, for example, the adjustment for 2024 would be based on your income-related reported on your 2022 tax return. And keep in mind, the premiums showed here do not include premiums for drug plans, Medicare supplement, or Medicare Advantage plans. This is for Part B and Part D only. In addition to premiums, there will be some other out-of-pocket costs under Medicare. If you have to be hospitalized, the first $1,632 in hospital costs will come out of your own pocket before Medicare starts paying. Some private insurance plans cover this, as we'll see in a minute. The Part B deductible is fairly reasonable, of about $240 per year. And this is waived for some preventative services such as flu shots and certain screenings. The Part D deductible is $545 per year under the standard Medicare design. but Part D coverage is quite complicated, as we'll see here in just a minute. After you've met your deductibles, there are some other costs. Medicare doesn't pay your entire medical bill. If your hospital stay exceeds 60 days, you'll be responsible for $408 per day up to the 90th day, and $816 per day up to the 150th day. After that, you'll pay full cost. Medicare, and again, that's what Medicare covers. Medicare pays the full cost of 20 days of skilled nursing care. After that, you'll pay $204 per day for days 21 through 100. If you need more than 100 days of skilled nursing, you'll pay full cost. As part of Part B, your responsibility is 20% of the Medicare approved costs. Doctors who accept assignment agree to be paid directly by Medicare and will not bill you any more than the Medicare approved amount. Doctors who do not accept assignment may charge more. If they don't charge more than 50% over the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest, the 20 plus the 15% over. Little complicated there, I know. It's a lot we're throwing at you. And there will be, maybe this is a good time for you to mention, there will be a recording of this posted on our website. So if you're not getting all this, feel free to pop on there and rewind and go over some of this, or like I said, reach out to us if you have any questions. Under the standard drug plan design, the beneficiary pays a $545 deductible, then 25% of drug costs after that deductible has been paid. Then there's a small copayment once out-of-pocket spending has reached $8,000. But these as I mentioned, these drug plans do vary widely. Some will pay more, requiring you to pay less. It will be important to find the plan that covers the drugs that you actually take now, if you are taking them. So that's going to be another important consideration, as you can imagine. After looking at all those out-of-pocket costs that you have to pay, you might be wondering what Medicare does cover. Well, it covers the first 60 days of hospitalization minus the deductible, of course. It covers 80% of your doctor bills. It covers some preventative services. But the best reference for finding out what Medicare does cover is the Medicare and You book. To get it, you can call 1-800-663-4227 or go to www.medicare.gov. The Medicare and You booklet spends over 20 pages or so talking about what Medicare covers, and the only one page talking about what it doesn't cover. I'm not talking about partial payments. I'm talking about no coverage whatsoever. For the list of services you see here, now some of these things you can avoid, like cosmetic surgery is optional, for example. If you never go outside the United States, you don't have to worry about that one. But some of these other things may be necessary. Dental work, eyeglasses, hearing aids. These things are you'll have to cover yourself or with another plan. This is where private insurance comes into play, of course. Private insurance can cover all or part of your deductibles, those hospital costs after 60 days, and the 20% of doctor bills that the Medicare doesn't pay. And of course, all prescription drug coverage is offered through private insurers who contract with Medicare. Medicare alone does not cover them. So you, again, just going back to those private insurers and how the drug coverage will tie into Medicare and what they don't cover. Depending on the drug plan you choose, it may cover the deductible, and it should cover most of the cost of certain drugs during the initial benefit period and the catastrophic coverage period. But it won't cover all drugs. Each plan has its own list of drugs called a formulary, which is always hard to say, and it won't cover much, if anything, in the donut hole. So just reiterating, I know we keep driving this home, but really just diving into the details of what each of these plans, and in this instance, the drug plan, making sure it covers and you have expectations correct, especially with the prescription drugs you might be already taking. Medicare supplement insurance, commonly called Medigap insurance policies, are issued by private insurance companies and are designed to fill the gaps that Medicare doesn't cover. although they're not affiliated with Medicare, they do have to follow certain federal and state laws designed to protect you. Medigap insurance policies are standardized. They're identified by letters A through N. So if you buy a Plan G in California, it will offer the same benefits as the Plan G in New York. However, the premiums can vary considerably from company to company and from area to area. So that's why it's important for you to carefully evaluate Medigap insurance and not pay too much and understand what you're paying for. This table shows the various benefits for the various plans. This is in the Medicare and You booklet, so you don't have to memorize it. But the main thing to remember here is that you're looking at if you're looking at a particular plan, it will be the same as every other plan offered by other insurance companies. So you want to make sure that you don't overpay for the same policy you can get elsewhere. So pick the right policy for you and then go shop the companies. Medicare Advantage plans, also called Part C, are offered through private insurance companies that contract with Medicare. So they have a direct relationship with Medicare, unlike Medigap policies. Medicare pays an amount to the plan for each member's care, and the plan is responsible for coordinating and providing the care after that with that flat fee. You may have to use the networks. In these instances, you may actually have to use the networks doctors or hospitals. So you want to understand, if there's a doctor you need to see or want to see, you have to look at that and make that consideration. You want to obviously want a plan that includes prescription drug coverage and understand what that means for you, because that is included in this blanket plan. And you may even be able to get extra benefits like vision care in some of these plans. But the benefits and cost sharing for Medicare Advantage plans are different from those for the original Medicare. So again, you'll need to shop carefully and understand, just going back to those two different directions, original Medicare, Medicare Advantage plans, and understand the differences, costs, as well as what's included. Just a reminder once again to shop carefully for these plans. I mean, I can't stress that enough. Just understanding which plan is going to be best for you, considering what drugs you're taking, the costs, the different things included in the plan, and just really be mindful of and just try to put yourself in the shoes of your future self and understand what that's going to look like, and making sure you're making the right choice. Again, we're here if you need any help through talking through some of those things, the costs, the direction, and just let us know if you want to speak directly about some of those considerations. And now we come to part 3, which is planning for these higher costs that we mentioned, costs in retirement, healthcare costs. Here's a look at healthcare spending by gender and by age group. Now, women tend to spend more than men on healthcare, and older people spend more than younger people. A large part of these higher expenses later in life are actually connected with long-term care. Here's what a typical Medicare budget might look like today, considering premiums only. The Part B premium is $174.70, like we mentioned. A Medigap premium is about $200, and the Part D drug premium is about $40. This brings you to a total of about $414.70 on average per month per person. Considering both premiums and out-of-pocket costs, the typical healthy Medicare beneficiary might spend over $6,000 in premiums. So obviously, if you take those at $500, you're looking at, and you multiply it by 12, you're looking at around $6,000 per year. Non-covered prescription drugs and other out-of-pockets for dental, including the non-covered prescription drugs and other out-of-pocket for dental, vision, and alternative care. So $6,000 is for that healthy Medicare beneficiary, and of course, it would just go up from there. And what can cause your healthcare budget to change? And we also already mentioned inflation is a big possibility. And then, of course, the possibility of getting sick. Your costs will obviously go up in that case. As healthcare costs continue to rise, insurance premiums go up, and the non-covered services that you pay for yourself get more expensive. So if you get sick, you may need more expensive prescription drugs. And there's also there's always the possibility that as you age, you'll require more non-covered services like major dental work, hearing aids, and of course, long-term care. How can you plan for rising healthcare costs when you, the question we're going to ask is how can you plan for rising healthcare costs when you might be on a fixed income when you retire? Well, one way is to set aside funds to cover your future healthcare costs before you retire. Fidelity does a study every year to determine how much the average couple might need at the start of retirement to fund all of their future healthcare costs, not including long-term care. They say the average couple will need about $315,000. The Employee Benefit Research Institute did a smaller study with slightly different variables and came up with $142,000 for men and $159,000 for women. So we're looking at roughly $296,000 for a couple. But of course, these are just the averages. If you live longer than the life expectancy, or if you have different healthcare needs, you might need more. And remember, these amounts, I must reiterate, these amounts do not include long-term care costs, which are going to be additional. So how many of you know someone who got old and needed long-term care? We're not necessarily talking about nursing home care. Long-term care can range from someone who is coming to the home for a few hours a week to help with meal preparation to skilled nursing care. So the important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, they're not going to pay for it. The average period of skilled nursing care is just 28 days. And when it comes to what they call custodial care for help with activities of daily living, there's no coverage at all. Before you say, I'll never get old and need help, consider this. 35% of people over the age of 65 have activity limitations. Some of them need help with so-called instrumental activities of daily living, which includes things like shopping and cooking. Others need help with things like bathing and dressing. Here we see the causes of activity limitations for people over 65. More than half of this population suffers from hypertension, and nearly that many, and of course many of them deal with arthritis, which holds them back quite a bit. And these numbers take into account a wide age range. We know that these conditions can usually get worse, much worse as you get older. So this is going to be covering a wide age range and not by age. So there's a wide bell curve here, but it gives you an idea of some of the limitations. When you're healthy and active in your 60s, it's hard to imagine not being able to bathe or dress yourself. But it's just a fact of life that people just going to need more help when they get older. And nearly half of all the people over 85 have some difficulty walking. And this is in and of itself can limit the things you can do for yourself. For most people, the need for long-term care is very gradual. You start out needing help with shopping, preparing meals, doing housework, managing money, and traveling. This level of care is often provided by a family member or a paid housekeeper. Then you get to the point where you have difficulty with these essential activities of daily living: eating, bathing, dressing, going to the bathroom, transferring yourself from chair to bed, and maintaining continence. I know nobody likes to think about these things, but we all know of people who've needed this custodial care. The third level of care is skilled nursing care. This is care provided by a licensed nurse for a medical condition or rehabilitation. Sometimes this level of care is short term, and if you need it for more than 100 days or less, Medicare and Medigap might pay for it, depending on which Medigap policy you have. But sometimes skilled nursing care is needed for a longer period of time, and then the cost can become burdensome from that point. So how much does long-term care cost? Well, it varies with the type of care, of course. The Genworth annual cost of care survey shows us that the median cost of care across the United States and homemaker services cost about $163 per day. And home health aid services are about $169 per day. Adult daycare costs about $78 per day on average. However, it can range from $30 to $160 per day. Residents in an assisted living facility can range from $3,000 to $7,000 per month, depending on the location and the amenities. And the median monthly rate is about $4,500 per month. The most expensive type of care, of course, is in a nursing home where residents can get skilled nursing care. A private room ranges from $200 per day to $1,200 per day. The median daily rate is about $297. A 1-year rate at this rate, and you're spending about $100,000 a year. None of us want to think about getting old, of course, and needing long-term care, but there are some very compelling reasons why we need to consider this. One is to spare your kids or your family members of the burden of taking care of you. They might not be mind doing some shoppings and paying some bills for you, but if you need constant supervision or help with bathing and dressing, that's beyond the call of duty for even anybody, even the most devoted son or daughter. Another reason to plan for long-term care is to avoid having to spend down assets in order to qualify for Medicaid. Medicaid is a state-run welfare program that will pay for your care if you don't have any money. But the point is that you have to pay down your assets to $2,000. You have to have less than $2,000 of assets anywhere to qualify, essentially leaving yourself with not much less left. So people on Medicare don't have a lot of choice. To add to that, people on Medicare don't have a lot of choices about their care. And this is another reason to plan for your own long-term care, to be able to direct your own care and obtain the kind of quality that you want. When you're paying for it out of funds you set aside for this purpose, or when you have insurances paying for it, you can decide how you'll be cared for, whether it's in your own home or an assisted living facility of your choosing. There's a lot more to say about planning for long-term care. We actually have a whole nother webinar on long-term care. If you want to go on our website and check our website webinar section, or if you want to reach out to us, and we could send you some quotes, talk to you a little bit about what planning for long-term care. There's ways to have long-term care insurance that will supplement your need for funds to cover that long-term care in those events. So again, just reach out to us. Let us know if you want to talk a little bit more about that. It's a whole another webinar, a lot of details there. The 3 reminders when it comes to sum everything up from today, it's obviously to enroll on time, like we mentioned and this is to avoid any extra costs with penalties and to avoid any coverages, gap coverages. Reminder 2 is of course, you've heard of me say probably a dozen times, is to shop your private insurance that will supplement your Medicare insurance, or shop for Medicare Advantage plans carefully, making sure you're looking at your drug coverage, looking at the coverage the coverage that they provide, including the doctors that you're already seeing, the doctors you want to see, and any limitations that might be there you want to avoid. And finally, it's not time to plan for, depending on where you're in retirement, if you haven't planned for it yet. Actually, what I really should say is never too late to start looking at what this higher cost of healthcare and retirement might look like for you. Like I said, we'd be happy to look at what that might mean for you if you have a retirement plan at all, and making all those considerations. That is all I have for you. I'll leave you with that. That if you want to set up a call about this or anything that is unique about your situation, you're worried about whether you're on track for retirement, your retirement plans are you're feeling confident about them, please feel free to set up a consultation. We can just lay out how we might be able to help. You can set up a call at our website at www.bautisfinancial.com, or click the link below, or you can email me directly at john@bautisfinancial.com. So thanks for joining me today, and hopefully if you have any questions, you'll reach out, and we'll be talking to you next time.